Introduction. Today, most doctors, dietitians, as well as diabetes specialists, consider type 2 diabetes to be always chronic and progressive disease, a life sentence without a chance for parole. However, the truth, as Dr. Jasmine reveals with this paradigm-shifting book, is the fact that type 2 diabetes is reversible. Writing with clear, persuasive language, he explains why common treatments that depend on insulin or additional blood glucose-lowering drugs can exacerbate the issue, resulting in significant putting on weight and even cardiovascular disease. The only path to take care of type 2 diabetes effectively, he argues, is proper dieting and intermittent fasting, not medication. The Everything Guide to Managing Type 2 Diabetes provides easy-to-follow advice on all areas of coping with diabetes and can help you recognize the symptoms of prediabetes and diabetes. Monitor your blood sugar levels. Find out about the types of insulin and insulin delivery systems. Understand the need for nutrition and exercise. Decrease the short and long-term ramifications of diabetes. Chapter 1. What is type 2 diabetes? Type 2 diabetes is a lifelong disease that helps to keep the body from using insulin just how it should. People who have type 2 diabetes are thoughtful to have an insulin level of resistance. Folks who are middle-aged or older are likely to understand this kind of diabetes, so that it used to be called adult-onset diabetes. But type 2 diabetes also impacts kids and teenagers, due to the fact of childhood weight problems. It's the most typical kind of diabetes. You will find about 29 million people in the U.S. with type 2. Another 84 million have prediabetes, indicating their blood sugars or blood sugar are high, however not high enough to be diabetes yet. People who have type 2 diabetes do not make or use insulin correctly. Insulin is a hormone that regulates the motion of blood sugar, or glucose, into cellular material, which utilizes it as energy. When sugars cannot enter cellular material, this implies too much glucose collects in the blood. Your body's cells cannot utilize it for energy. A healthcare provider may diagnose diabetes if someone's blood sugar is 126 milligrams per deciliter, or above after fasting for 8 hours. Symptoms. The symptoms of high bloodstream glucose in type 2 diabetes tend to appear gradually. Not everyone with type 2 diabetes.
Sample complete. Ready to continue?